We're in the operating room today, and you might ask, why do we have anatomical drawings in the operating room? Doesn't the surgeon know what they're looking at? Well, we do, but they're useful to help explain to other team members what's going on. Let me show you something. This here is a gallbladder, and is right underneath the liver. Its job is to store excess bile produced by the liver and release it in time with meals. When it's diseased, it's not functioning properly, and it's much better to have it removed. That's what I'm talking about today in this video. So we're back in the office. But before I tell you the 5 things your doctor may not have mentioned about gallbladder surgery, let me tell you why we can remove the gallbladder safely if it's diseased. The gallbladder has one job, and that's to collect bile, concentrate it, and release it in time with meals. But if you're making gallstones, your gallbladder is not contracting properly. It's not doing its job. So if you're a gallstone maker, you're already living your life functionally as if there is no gallbladder. That allows us to remove it and have your symptoms improve. So what are the 5 things your doctor may not have mentioned about gallbladder surgery? Number 1, you can eat normally. Very often, people prior to surgery are assigned a low-fat diet. The purpose of that is to prevent future gallbladder attacks, to stop the stimulation causing the gallbladder to contract. But once your gallbladder is removed, there's no reason to avoid fatty foods whatsoever. You can eat normally. Number 2, you do not need any supplements or enzymes after gallbladder surgery. The liver makes just as much bile after the operation as it did before, so there's no reason to add anything back in. If someone's telling you you need to take some enzymes, they're either misinformed or they're trying to make a quick buck. Don't fall for it. Number 3, gallstones can come back. It's a rare case, but sometimes gallstones can be formed in the little bile ducts that drain the liver. It usually happens years in the future, so it's not something you have to worry about, but it's also something to be aware of. It is possible. Number 4, diarrhea can occur occasionally after gallbladder surgery. Now, some YouTubers will overemphasize this risk, but in reality, it only happens in up to 10% of patients, and usually it resolves within days to weeks after surgery. Only 1% of patients have any kind of chronic symptoms that require ongoing medication. So it's not something to worry too much about. And number 5, sometimes gallbladder surgery will not relieve all of your symptoms. Gallstones are made by many people, and not everyone needs their gallbladder removed. So sometimes it's hard to figure out exactly which patients and which symptoms the gallbladder is responsible for. That being said, the vast majority of people who have their gallbladder removed are happy they did so and get great symptomatic relief. Gallbladder surgery is one of the most common operations performed. You may have questions, and I'd encourage you to discuss them with your surgeon prior to the operating room. If you want to learn more about gallbladder surgery, I'd encourage you to stick here with Knife Skills and check out this video down below where I even go in more depth about gallbladder surgery. My name is Dr. Hillsden. This channel is Knife Skills, and once again, thank you for watching.